Hello everybody, my name is Dr. Arthur and I'm here to talk about prostatitis. So this is a microscopic inflammation of the prostate gland and spans a wide range of diagnoses and syndromes. So what's the prostate gland? The prostate gland is an organ that we find right in front of our bladder and helps us produce what we call a seminal fluid that's found in the semen of men and helps nourish our sperms. So what happens is that this gland gets inflamed in the sense that it gets swollen up due to infections, or sometimes it actually may not have any causes about it. So we have about 4 types of prostatitis. We have the acute prostatitis, we have the chronic, then we have the chronic pain prostatitis, and then lastly we have the asymptomatic inflammatory prostatitis. I'll go ahead and explain what each of these mean and how they present. Acute and chronic are actually defined as a confirmed bacterial infection of the prostate with urological pain and usually treated with antibiotics. And when you look at the chronic pelvic pain syndrome, it's actually confirmed as a urological pain with no confirmed bacterial infection. And then you come to the asymptomatic, just like the name, it has no symptoms and it's just found coincidentally during examinations. So the patients really have no symptoms for this case. If we talk about the pathophysiology, the route of infection is usually through our urethra and the prostatic ducts. Our urethra is actually the tube that empties our urine from our bladder and out through our penises or the vagina. And the prostatic ducts usually is actually a tube that connects our prostate to the urethra. And if you may remember me mentioning earlier on, the prostate produces some fluid that nourishes our sperms, and that's where the fluid passes. So key things in this infection actually is sexually transmitted infections. So people have that history, they have a higher chance of having prostatitis. And the commonest organisms that cause this are what we commonly know as gram-negatives, for example, the E. coli. So how will this patient present? The patient will be complaining of pain when they sit, they'll have pain when they're urinating, they'll be waking up in the night to urinate numerous times, they'll find themselves urinating a lot more than normal, they'll find the discharge from the urethra or from their penises, they'll feel pain whenever they ejaculate, they'll have pain after having sex, and some of them will have erectile dysfunction. So for us to make a diagnosis of this, you'll need a physical exam with the attending physician, and you'll also be able to do a couple of tests on you to direct us to which type of prostatitis you have. And that will help us decide on what treatment we shall follow, whether we shall give you antibiotics or we shall just be pain management only, or you may need to see a urologist for further management. For more inquiries or any other inquiries you'd want to have, you can always have a consult with the Rocket Health doctors by dialing *280#. And for those who need any pharmacy refills or for medicine refills, we also have the Rocket Health eShop by clicking on the link in the description box down below.